Hello everyone, welcome back to 3 News Now. I'm Stephanie Haney and today is Wednesday, January 26th. Thank you for being here for the top stories that you are clicking on, that all of you are reading on WKYC.com and our WKYC app. A big story today, a national story, is that Supreme Court Justice Stephen Breyer has announced that he will be retiring at the end of this term. Now, he has been on the court since 1994. That's when he was appointed by President Bill Clinton, nominated by President Clinton, and that confirmation by the Congress as well. So he's a former Harvard professor and an aide to Senator Edward Kennedy in the 1970s. Breyer has been among the leading Supreme Court voices cautioning against viewing the judges as politicians in robes. He's commonly associated with the liberal sect of the court, though they are not officially to have political leanings. Speaking to a Harvard audience in April, Breyer said that it's wrong to think of the court as a political institution, and he urged supporters of expanding the court, adding more seats to the bench, to think long and hard about what that would do to the institution. And now he has decided to step down. It is always the decision of a Supreme Court justice when to retire, unless they happen to die while on the bench. And then, of course, then they are no longer able to serve. U.S. Senator Sherrod Brown said this about Justice Breyer today. Stephen Breyer dedicated his life to serving the American people, and for nearly 3 decades, he was a trusted, thoughtful voice for justice and the equal protection of all Americans on the Supreme Court. He understood that Supreme Court justices serve for the public, not powerful special interests, and he was unafraid to stand up for the rights of workers and their families. I'm confident President Biden will appoint a justice who will continue that legacy, someone who understands that a commitment to the Constitution and to equal justice requires standing up for the civil rights and standing up to corporations on behalf of Ohioans and citizens around the country. So, of course, now the conversation turns to who will President Biden appoint to replace Stephen Breyer on the Supreme Court. It is not known exactly who he will nominate, but Biden did promise to name a black woman to the Supreme Court if a vacancy opened, and we do know that that is coming at the end of this term. Judge Ketanji Brown Jackson is seen as a leading candidate for the seat. She was elevated by President Biden in 2021 from a trial court in Washington to the Federal Court of Appeals. She also once worked as a Breyer law clerk at the Supreme Court. For more possible people who might be on President Biden's shortlist, you can head to WKYC.com for that. Now, bringing it back home, some troubling news today out of Richfield. A Richfield nursing home resident was found dead outside in the snow. So police are now opening an investigation. This happened early on Tuesday morning. A nurse at the Renaissance of Richfield Bath on Everett Road called 911 around 6 a.m., just before 6 a.m. on Tuesday, and told the person on the phone that a person had been found deceased in the facility's courtyard. When an officer got to the scene, the victim was identified as 75-year-old Richfield native Peggy Jurosik. Richfield police say that they are working closely with the Ohio Department of Health to determine what happened, but have mostly declined comment because they are citing this as an active investigation. However, the police did extend their condolences to the loved ones, the family member, and the friends of Peggy Jurosik. Now we learn from the Ohio Capitol Journal, an investigation into nursing homes here in Ohio has found errors and deception, and all of these things led to a deadly COVID-19 outbreak. The deadly COVID-19 outbreak, remember, so many of those early cases were at our nursing homes. So regulators found infection control violations at least 3 dozen Ohio nursing homes, and that placed the health and safety of patients in immediate jeopardy. And in that instance, when a place is in that immediate jeopardy category, that's when you get to fines and things. So it was between allowing nurses with active COVID-19 infections to report for care, placing infected people in rooms with uninfected people, circumventing preventative measures, that's like masks and quarantines during the outbreak, and other preventable errors. Inspectors found many instances of infection control failure from the nursing homes that preceded massive and deadly outbreaks during the pandemic. Now, when this conduct placed these places into that immediate jeopardy status, that leads to fines from the Centers for Medicare and Medicaid Services. And sometimes facilities have to stop admitting new patients until they can fix those errors. Some of these allegations, by the way, they go beyond negligent conduct and actually toward deliberate acts. In 2 nursing homes, for example, inspectors for CMS claim that staff sent fake samples into the lab or backdated test results to make it look like they had stronger responses to outbreaks at their early stages. Some really shocking allegations in this investigation from the Ohio Capitol Journal. This is on WKYC.com. Hundreds of thousands of dollars in fines to CMS detailed. For the specifics on this, I encourage you, head to WKYC.com. It is mind-blowing. Now let's take a look at the latest COVID-19 numbers in from the Ohio Department of Health. Remember, we did yesterday get news from the Ohio Department of Health that there was invalid data submitted by an external facility. So today, the case count is 20,752, and they say that this is inflated and it's accounting for a backlog of those cases from the invalid data that was previously submitted by that other facility. What we have right now in terms of our positivity rate is 26.5%. So for all of the COVID-19 tests that are documented, 26.5% of them are coming back positive. Right now, there are 4,996 people in the hospital being treated for COVID, and I am happy to say that for the first time in a while, less than 1,000 people being treated in the ICU, 993 people being treated in the ICU here in Ohio. Now, we've been dealing with the Omicron variant that has been sweeping across the country, but now the World Health Organization is taking a look at a new subvariant of the Omicron variant of COVID-19, and this is dubbed BA2. So it's not necessarily something new. So let me explain. Right now here in Ohio, there are no reported cases of the BA2 variant. That's according to University Hospital's Dr. Claudia Hoyen. Here's what Dr. Hoyen says, that back in December, the two variants of Omicron split off. One is the BA1, and that's around the world right now and here in Cleveland, and it's about 99% of all the Omicron cases that have been seen. The sister or the brother variant, the sibling variant, is BA2, and it was first identified in Asia, probably the Philippines. So it's believed that it was back in December that those variants split off. And Hoyen says the variant is being dubbed stealth Omicron. It makes up 50% of the cases in Denmark. And the reason it's being dubbed stealth Omicron is because it depends on the PCR sequencing test that you're using, but because of the mutations, that initial part of the PCR test doesn't necessarily attach very well. That helps, identify that DNA. So you might not get a positive result. And it is too soon to know much more about this sub-Omicron variant, but as soon as we have more information, we will get that to you. Now, our Verify team has checked out a claim that whether COVID-19 can be transmitted through secondhand smoke, and the answer is yes, it can. One of the primary sources on this is cardiologist Dr. Pale Coley, and it does have the potential to spread through droplets in secondhand smoke. So Johns Hopkins Medicine says because smokers take off their masks when they are smoking in between puffs, they can spread the virus. Now, secondhand smoke isn't directly spreading the virus, but if a smoker has COVID, they might blow droplets with the virus when they exhale that smoke. And secondhand smoke or smoke in general helps those aerosols to suspend and stay in the air. So it could stay in the air longer and travel farther. The cigarette smoke is almost like a vehicle to carry those droplets possibly farther and in the air for longer. So keep that in mind if you are a smoker and you are positive for COVID-19. Now, turning to the online world, Cleveland Browns quarterback Baker Mayfield has let us all know that he's taken a little break from social media. And I will be the first to say a break from social media can be a beautiful thing. I have done this many times from time to time. And it was on Tuesday night that he let us all know. He said, getting off social media for the foreseeable future. Got to do what's best to focus on me, my family, and loved ones. Appreciate all the support. Time to get right. So we're wishing Baker the best in this break from social media. We look forward to seeing him on the other side when he's had some time to be with his friends and family and loved ones and to focus on his recovery and whatever it is that he needs to do, in his words, to get right. Something that we will see back very soon are the Budweiser Clydesdales. Budweiser didn't have an ad in the Super Bowl last year. First time in 37 years that Budweiser didn't have an ad. Now, they did have ads. Anheuser-Busch had ads for Bud Light, Michelob Ultra, and some of those seltzers, but not a Budweiser ad. So that's changing this year. They are coming back with the Clydesdales, and we know that because Anheuser-Busch released a trailer, a 10-second trailer showing the hooves galloping. So all we see are the hooves, and it says, "We're back 2/13/2022, which of course is the date of the Super Bowl. It's a 10-second trailer. Blink and you'll miss it. But if you want to see it, we do have it linked on WKYC.com. And if you are feeling neighborly, last thing to let you know before we go here, a Lakewood nonprofit is looking for snow shoveling volunteers. Lakewood Alive works with residents of Lakewood to help shovel snow for the elderly people in the community. The Cleveland Clinic, by the way, says anybody over the age of 55 or with more than one medical condition should probably not shovel because it's not worth the risk. But you do need to get out of your driveway, right? So right now, there are 30 to 40 volunteers with Lakewood Alive, and they are working to clear 80 driveways this winter. So they've got those 80 driveways. They're predetermined. They've got a plan in place for those 30 to 40 volunteers, but they need more volunteers because they also have 40 driveways that are on the wait list. So if you are so inclined, and you are not in that category of 55 and older or with those medical conditions that might make it not so great for you to do that, reach out to Lakewood Alive. We've got all that information on WKYC.com. Get yourself a little extra shoveling in, and especially if you've got a snowblower, maybe that could be for you. Maybe we need to get in touch with that unicorn snowblower, not to add any tasks to anybody's plate, but not a bad idea if you are open to it and looking for the exercise. All right, that's it for your 3 News Now update today for Wednesday, January 26th. Everybody, we're more than halfway through the week. That's always great news. I will see you back here tomorrow with more 3 News Now.